Hey guys, so I am on my way to get Oz. I left the gastroenterologist appointment, and I don't really know a whole lot. He didn't speak English super well. He's been here for a very long time, and he spoke English fine, but it was just very he was nice, and he wasn't not friendly, just culture wise, just a little different. And I did cry, not a lot. I just had I don't know what I was expecting. And he actually didn't give any, I didn't even tell him about constant burping or indigestion. They didn't really give a lot of he has a lot of questions about my weight loss, and apparently they do like medical weight loss there. And I thought he was actually questioning me. I thought he was going to ask me to join that group to lose weight, but he wasn't. I didn't realize at the time exactly what he was asking me. He was asking me what I think it takes to have long-term weight loss success, and what I feel like is most important to keep the weight off. And I wish I would have realized what he was asking. I would have answered a little bit differently. I mean, obviously I talked about making healthy choices and making sure that you're moving your body, but because really at the end of the day, that's what it's all about. But I wish I could have answered him a little differently, to say that every day when you wake up, you have to make the choice, or at least for me, what kind of day you're going to have. Anyways, so that has nothing to do. It's already 2 minutes in. Oh, good Lord. So I'm going to have a scope done, an endoscopy done on March 17th. They tried to get me in next week, but I couldn't do it because Ed has to work, and he can't get off. So I'm having that done March 17th, and then I'm also having a barium swallow study done. He really didn't say one way or the other what he thought it was. He really didn't think it was Barrett's esophagus. And I didn't ask specifically about a hiatal hernia. He said that, it's possible that it's just reflux, or that I may have a little pyloric esophagus, H. pyloric, which just can be cleared up with medications. And then long term with the reflux, it's just something I'll have to stay on forever. And he actually asked me, he said, what are you going to do if it's just reflux? And I said, be on medication? I don't know. And you know what? I hope that's all it is. And it totally did not come from him necessarily, but I left feeling just as crazy as I have been. I know nobody else is in my body, and everybody's pain tolerance is different, and I'm not hurting every day with the chest and back pain. But I will tell you that I have been really uncomfortable for a long time. And had I really stopped to put the pieces together, I should have had this done years ago. But I didn't. I will also tell you, even though I think I still need to have it done, had I not had the vertical sleeve, I'd not had BSG, I probably would not be as concerned as I am at this moment. Truthfully, technically, I probably need to be seeing my bariatric surgeon right now, office, so that they can handle all of this, so that if something needs to be done, like a revision, or if there is a stricture or anything, they could take care of that. I don't know how knowledgeable he is in that area, but that is just not something I can have done right now, because our insurance does not cover any kind of affiliation with the bariatric doctor. And any bariatric doctor, not just the one I had. So I feel a little crazy. And as much as I hope that that's all that it is, I also would like to feel not crazy. So he did say that H. pyloric in the esophagus could actually cause some of the symptoms I'm having. And again, I should have asked him how comfortable he felt doing this on me, with my history of the sleeve. I'm just not in a good place today. I'm really sorry. So this is what you're going to get. I don't know. I do not want to be a wine baby, and I do not want to have something wrong with me. I'm perfectly fine and happy and healthy at 230 pounds, and if I could just stay here, that would be great. I'm really happy having one baby. I would love to have a... Sorry. What I was saying was, I swear I'm not constantly a whiny crying person. And I know that I feels that way, and I feel crazy every time I come on here and keep talking about the same stuff. Again, I don't want there to be anything wrong. It's just so different when you become a parent. Because I think that I would have let this go for a long amount of time. Because I don't want to be that person that's complaining. Anyways, like, my foot hurt the other night because I had fallen. I tripped and I couldn't remember why my foot was hurting, and then later it dawned on me. I didn't even want to talk about it or say anything because I felt like I was a big baby. That's the reason I didn't go to the doctor for my finger. Anyways, I just think, please don't be like me, okay? You need to be positive and strong, and if you feel bad, if you feel sick, if you feel like something's wrong, you go to the doctor, and you don't let anybody tell you not to. And guess what? If they tell you that your esophagus and tummy's just fine, well, you just say thank you. You don't listen to anybody. It makes me so mad. What if there would have, I mean, maybe there really is something wrong. I mean, who knows? And then I would have let it go even longer. Anyways. So yeah, let's just change the flow of this, because I need to just quit making a video. And you sit and you think about what's going on in your life. And if you have a pain, if you think you're having a heart attack, you don't listen to anybody else tell you that there's no way that's possible. You go to the doctor anyways. That's my PSA for the day. You look it up on Mr. Google if you want to. Anyways, alright guys. So, yeah, it'll be a few weeks before we know anything for sure, and that's fine. I mean, it's fine. I'm just so thankful to have the ball rolling, and I asked today how much she thought things would be, and she said she didn't know, but that they would call me and tell me. So if she calls back and says it's going to be like $5,000, I'll probably say, oh, jeez, Lisa, we can't do that.